I want to welcome you. My name is Judy Mark, Judymark, and I'm she, her, and I am a white woman who is standing in an office with a bookcase behind me wearing black and white earrings and black and white shirt. And I am the president of Disability Voices United, which is an organization that was founded by people with developmental disabilities and family members. And now we work across the disability community. I also have a son who's 24 with autism and is very vulnerable to potentially having a poor impact, a poor outcome of the COVID. So I take this very, very personally. For those of you who might need closed captioning, we are offering it by going to for me, it's on the More button, but you can certainly show full transcript and subtitles. So let's get started. We have a very important group of folks today who are going to shine the light on the pandemic and its effects. You know, sometimes we get into the data and we hear, you know, thousands of people have died, millions of people are dying around the world, but what we are not really seeing is the human face behind it. And each of the three first speakers that we have today all have lost loved ones since 2021 began. And so their emotions are very, very raw and very new, and we are here to hear their stories. And we want to really thank them because this is quite difficult and courageous for all of them to be here today. So the first person I'd like to introduce is Hector Manuel Ramirez, who is an activist in the disability community himself, but sadly lost his brother Eduardo 4 weeks ago this week. And I'm going to show a picture at the beginning of Hector and his brother Eduardo. Go ahead, Hector.
Thank you, Judy, for this. Gracias. Buenos días. My name is Hector Ramirez. I am Chicano Passion Mexican. I am autistic and I have a psychiatric disability. I live with my family here in Los Angeles County in the city of Los Angeles and the ancestral lands of the Tongva band of San Bernardino Mission Indians. And that's my brother, Eduardo Ramirez. And he died he died 4 weeks ago yesterday. He was a person who was at high risk. He was a high risk Californian person with a disability. He had AIDS. He had been living with AIDS now for, almost 15 years, surviving it, thriving it. We are a family that survived the AIDS epidemic in a way in the 80s when we lost our friends and our family members and we fought. And then when the disease came into our family, we came together to support our brother. He died because of this new pandemic. You know, as a person with AIDS from the beginning, it was very difficult for him to go to the store, take the bus to go to the doctor, you know, even just go to the hospital, which he had to do on 9 different occasions since the pandemic began because he couldn't get medical services. He started developing opportunistic illnesses, right? One after another, after another, after another, just like we had not seen since the 80s with some of our other friends. Towards the end, wasting came in and, you know, this is my brother and look how skinny he was. This is one of the last pictures we took together here in my house. I am in my bedroom right now at the same house in the video next to the bed where we took care of him because he couldn't go to the hospital. You know, my family and I did our best to take care of him, you know, in our community because he couldn't go out literally. And, you know, it's unfortunate because my family has been working nonstop. He's not the first person in our family to pass from this. He's now the fourth. You know, we are Native, we are Mexican, we are disabled, and I think that's kind of the recurring, you know, underlying theme. When each one of my loved ones died, it was just so complicated at the end, especially with the beginning with my aunt who was in the hospital and died alone. And none of us could see her, and we waited months to get her body. You know, the same waiting came with our other uncle, and then our other uncle, and with my brother. Even though he died 4 weeks ago, his body still just waiting alone in a freezer, you know, waiting to come home. And I know the waiting is just part of the most horrible thing. You know, for people like him, he ran out of time. And there's so many other high-risk Californians who are also just running out of time. I'm here in LA County where, you know, yesterday at Thatcher Stadium, you know, where they're vaccinating people in an equitable manner, there were 7,000 missed COVID vaccine appointments. 7,000. And we have so many people, especially here in LA County, who are Native American, Latino, Black, and people who are high risk for COVID with disabilities, you know, who could have used one of those 7,000 missed appointments. I'm not sure what's equitable about that. We can't use the buses because it's not safe. You know, we can't access a lot of things the same way that other folks have. It's an issue of privilege to be able to have internet, to be able to drive, to be informed, and to just not be able to get the vaccine is a significant thing for my community. It's a daily nightmare to wake up every morning and just double check to make sure that each one of my family members is not coughing or has a fever. That's what we do. You know, we live on a daily basis. Just kind of reminder that we have to be grateful for what we do and compassionate, you know, but just not knowing what's going to happen at the end of the day. And for a lot of high-risk Californians, that's the life where they were living, not the life of privilege of being able to get one of those 7,000 vaccines that, you know, that were equitably handled yesterday. This is not a complaint against my governor. It's perhaps like complaint against the whole system, you know, because everybody in power has a responsibility to ensure that people who are at high risk are protected. Our most vulnerable folks that we work so hard. In the 80s, we created ACT UP to speak about people with AIDS, you know, and I think this is what's going on right now. So I want to thank all of you for listening to the story and creating this space, and hopefully you will help to uplift, you know, the voices of people who are not here anymore, who ran out of time, and also uplift the voices of those who are still here asking and yelling, you know, for maybe one of those missed 7,000 spots that could possibly save their lives. Thank you, Judy.
Thank you, Hector. We're so sorry for your loss. Our next speaker is Urix Martin. Urix Martin lost his partner of many years, Linda Ramos, who passed away from COVID in January last month. And I'm going to show a picture of her as well. Go ahead, Urix.
All right. Linda Ramos was my fiance, best friend, and the person I most wanted to spend the rest of my life with. We met in 1988 and became closer and closer, bound by our mutual interests and sensibilities, especially our shared senses of humor. We shared so much of our lives together. We introduced parts of our lives to each other. It was my mother's insight that Linda would be the one I would marry. Eventually, we decided to make our lives one. We'd lived together since April 1st, 2007. And in 2019, we bought a house together in order to care for her ailing mother as a family. To that end, we had hoped to get married in February of 2020 once the three of us had settled in. Unfortunately, due to reverses in her mom's health and COVID-19, we had to postpone our wedding. After her mother's death, we looked forward to spending the rest of our lives together as wife and husband. We never got the chance. By definition, Linda was fat, obese, to be exact. And true to her nature, she was an advocate, an active fighter for size acceptance. She also was cursed with adult onset diabetes and would constantly monitor and adjust to stay in control. As such, she was aware of the added dangers COVID-19 threatened if contracted and was rightly scared. We were very careful to keep her safe. We washed our masks at the end of every day and socially distanced when out. At work, she would avoid the break room and eat meals at her desk. When news the first vaccine had won approval for use, she was ready to receive it as soon as it was possible. Just as with her annual flu shot each year, she felt science would aid in helping her stay safe. It was somewhat demoralizing for her to find out that she and others with established pre-existing risk factors, not age-related, were being left out of the first wave of recipients. She continued to follow best practices, determined to stay safe until she would be allowed to receive the vaccine. Unfortunately, it was not to be. COVID-19 cheated us on January 9, 2021. At this point, I would just have to say that had she lived, the rigors of waiting her turn would certainly make getting her inoculation more difficult, if not impossible, more so than it needed to be. After damaging both knees in an accident, both back in 2010, standing more than a few minutes would have been impossible for her. I am sure Linda would worry about those without the option to simply drive up to a provider, those physically unable to wait in line for hours, people unlucky enough to have been dealt illnesses or maladies in their youth below a certain age range. Linda would have fought for their rights to be included for early consideration just as hard as she would have fought for herself. And that is one of the many reasons I continue to love her so much. This whole inoculation thing was never properly planned. The whole idea that things were waiting to the last minute to decide, the things that 50 different states were supposed to decide their own methods on how and who. This should have been done at a national level and it should have been planned long ago. That's just the way it is. I love Linda. I miss her. Thank you.
Thank you, Urix. We are so sorry for your loss. I love this photo that we showed. You could see the spirit and inside her and the light that she brought to the world. Our next speaker is Julie Snyder. Julie Snyder lost her loved one also in January of 2021, and her loved one named Joshua, and I'll show you a photo of him now. Go ahead, Julie.
Good morning, everyone. My name is Julie Snyder, and I'm here to talk about Joshua Mercer. Joshua was 46 years old when he died of COVID on January 4th, 2021. I met Joshua more than 30 years ago when he was 9 years old. I was working at a special education school where he was a student. We always had a close bond. From the minute I saw him, he just took my heart. Blonde hair, those blue eyes, just looking right at me. And he had some pretty severe behaviors at that time. And so we worked very closely together, a lot of one-to-one time, helping him to learn coping skills to calm down. It really creates a very close bond. And we did have that very close bond. And I became a permanent part of Joshua's life. I was his advocate and eventually his conservator and a surrogate parent. I saw him often and was actively involved in all aspects of his life. And although he had limited speech, he did have a good sense of humor. He enjoyed interacting with others. His active life included being outdoors, going for walks, hiking, taking day trips with his home, and just hanging out with his 3 roommates and staff at his home in North Hills. Josh loved to be outside, mostly because all of his life he loved to spin and play with leaves. So he would run outside and jump up as high as he could and reach a leaf from the tree and just spin around, spin. He was so good at spinning those leaves. And he enjoyed going to the movies and he went to the gym with the guys. He participated in a day program where he did volunteer work like Meals on Wheels, cleaning up at parks. And for the past 7 years, Josh had finally been stable. He was healthy and happy, and he was enjoying a good quality of life. Joshua had a diagnosis of autism, schizophrenia, and epilepsy, along with severe behavior challenges. Since 2011, he has needed a one-to-one aid to be successful living in the community. He was moved from the state hospital at Lanterman Developmental Center after spending about 3 or 4 years there. He could communicate his basic wants and needs, but only verbally, but not verbally. He could, express himself through gestures, and he had some basic words. So he couldn't express whether he was ill or upset. He needed assistance with all aspects of self-care and daily living, and he would not understand the need to self-isolate like other people without disabilities who could stay in their home without any contact with others. On December 29th, I got a call from the house manager that Joshua was having labored breathing. He had recently tested negative for COVID. That day, he went to the ER and then to Olive View Hospital in Sylmar, California, where he stayed for 6 days until he passed away. He had labored breathing, a fever, and he tested positive for COVID-19. He acquired COVID-19 from a staff member. And I think it's important to note that at no time was he in the ICU as I tell this story. Because of his disabilities, he had trouble keeping his oxygen mask on. He kept taking his mask off, and then the oxygen saturation level would go way down. They gave him steroid medications, which made him agitated, and that made it even harder for him to keep the mask on. The hospital staff would say, he's just really, having a lot of issues and seems so agitated, and we can't keep the mask on. His oxygen saturation level kept going down and fluctuating, going to as low as 40 at one time. As this was happening, they kept bringing up the fact that they were ready to release him to a SNF. And they said that he was on a trajectory for improvement on that Sunday. He died that next morning, I think. I explained that Josh is very compliant and he will leave his mask on if he has a support person with him. I kept trying to get the hospital to allow a support person in to help Josh keep his mask on. I asked the hospital staff to let me speak with Josh on the phone to see if that would help, but they said there was no phone in the room. Instead, they tied his hands down. They restrained him, and that was awful. On January 4th, in the early morning hours, hospital staff found Josh dead in his room. It is not known how or when he died because he was alone. The hospital called me to tell me, but I did not hear the phone. I spoke to the doctor first thing in the morning, and she sounded very upset. This was devastating and shocking to hear. As I asked what happened, she said she didn't know. It was just COVID related. She said that the nurses are so busy that they could only check on patients once in a while because they really needed to change their gear, as they went in and out of different rooms. I'm very sad about what happened to Josh, of course. But I hope that it will help others in many ways, especially to get the vaccine as soon as possible. People with disabilities need it badly. And I just would like to say that I have 5 friends with disabilities right now who are in the hospital and one who passed away on Sunday. So I think we really need to make a different decision. Thank you.
Thank you, Julie. I can't take much more of this. I'd now like to introduce Dr. Elissa Bergart, an anesthesiologist and bioethicist at Stanford Hospital, who will be able to tell us that these are not 3 isolated cases. So while we're putting a human face on this, which is critical, these are not the only 3. Go ahead, Dr. Burgart.
Thank you so much to the speakers who've shared your stories and your incredible loss. And unfortunately, working in a hospital system, I know that you're not alone. There are patients in ICUs across and on hospital floors across our state, younger than those of us on this call, who are dying. And they are dying because of COVID, because of the pandemic, and because our public health responses have not effectively taken into account the needs of our disability community, of our low-income communities, and of our people of color's communities. It is so incredibly important that we prioritize vaccination for high-risk Californians, like the ones that we've heard about today. We don't want there to be more death, more disability, more difficult outcomes for patients like the ones that we've just heard about. And things that are so incredibly important is that, the CDC certainly has a list of high-risk conditions. We have a lot of data to show certain groups are absolutely at higher risk of death and burden from COVID. We also know that that list is not complete. It is important for the state of California to do everything it can to prioritize all high-risk Californians. And that includes not just folks who might be included in the CDC guidelines, but additionally, we have data showing that people with intellectual disabilities, people with developmental disabilities, people with psychiatric conditions, we see that these have incredible outcomes that can be really high risk for folks, even though they haven't yet made it onto that list. And we should not be limited by the CDC list. We need to ensure that we're doing everything we can. If someone has been identified as high risk, whether it's by their community, by data that we have that is updated, or by their physician, or by a healthcare provider, we absolutely need to include them in a vaccine rollout, regardless of their age. Age is just not a good enough condition. We know that elderly folks are very high risk. We know that they're not alone in being high risk Californians. We need to ensure that we include people with disabilities and people with high risk health conditions. The other thing that's really important to realize is that, California has been in a massive surge that has pushed hospitals to the limit. And we know that there have been hospitals that have not had the resources they have needed to take care of the patients who have come. And so when we deprioritize people with disabilities to get vaccination, these are the same people who are at risk of systematic discrimination when they appear at hospitals for treatment. We must make sure that we are doing everything we can to protect high-risk Californians, to prevent disease whenever possible, and we know that vaccination is one of the most effective tools we have today, in addition to ongoing public health measures in terms of mask wearing and not congregating. So this is an equity issue, taking care of disabled Californians, taking care of high-risk Californians. This is something that protects not only people with disabilities, this protects people who are have intersectional identities. We have people who are low income, people who are people of color who are absolutely being harmed by this lack of access. So, I worked strongly 2 weeks ago to try to get a letter out. We had a letter signed by over 400 people, including 330 healthcare workers, as well as public health experts and people who are providing services out in the community. Our voices are strong. We need to ensure that we are protecting this population to the greatest degree possible to prevent further tragedy. Thank you.
Thank you, Dr. Burgart. Thank you for all the advocacy you've been doing as well. I'd now like to introduce Kara Ayers. Dr. Kara Ayers is from the Center for Dignity in Healthcare for People with Disabilities at the Cincinnati Children's Hospital Medical Center. And she's an expert on what other states are doing compared to California. Thank you for joining us, Dr. Ayers.
Thank you, and thanks for having me, for all that have joined today. And also just want to echo, I appreciate the courage for those that shared the stories of their loved ones and their legacies. In my role with the Center for Dignity, we have collaborated with Johns Hopkins Disability Health Research Center to develop a vaccine allocation plan tracker, because we realized as we dove in to try to make sense of these different state and territory plans that even ourselves as researchers with backgrounds in advocacy couldn't make sense of all the different ways that the states were defining disability or chronic illness or congregate care settings. So we started to notice some trends that states have overall done a fairly good job at recognizing the risk of long-term care residents, in that in most cases, states have prioritized that group, but they seem to miss the mark in most cases, again, that there still remains so much risk. I mean, as we've heard today, for people with disabilities who are out in the community, which is a goal that we always aspire for, because we know that those outcomes of community living are so much better. So besides the confusion that these different plans introduce in the way that they define disability, there's also that failure to recognize, as Dr. Burgart pointed out, that these categories are much wider than just a list of diagnoses, as the CDC has proposed. So some states are really limiting themselves to that set of diagnoses, and there needs to be a recognition that there is an inequity in limiting it to a diagnosis list. You're always going to leave out people who have more rare conditions. You're going to leave out underrepresented groups in research. So really a problem that we've had for a long time in public health, which is a data problem related to disability, is being magnified by COVID. And so as we've seen this over and over again, it's frustrating for advocates and researchers, because it really feels like we're not learning some of these lessons that we should be learning. So among some of the plans that I feel like are doing a better job at, striving towards equity, which we hear that term tossed around, and equity really means considering these different variables that people have. So it's not equality, which is just, across the board looking at only age or only employment status, or so equity is considering those different intersectional risks. And of the states that do a better job of that, it's actually the states that have more clear, broad definitions. So you're less likely to leave people out. You're more likely to allow people to be aware of their own health risks along with their provider, perhaps, and access the vaccine that they need because they're at a disproportionate risk. So people with disabilities largely have been isolated for months and months, and this is their chance. But as mentioned earlier, time is running out, and so we can't let this aspiration of perfect be the enemy of good in terms of getting this plan out, or getting this action out, this implementation out now. And just in closing too, also Dr. Burgart brought up for me that I like to hope, I'm also a proud disabled person myself. I like to hope that this is being overlooked or not understood. But I think there is a more concerning underpinning of this. We see this when we hear Joshua's story of, his experience in the hospital. There is ableism in our healthcare systems. There's a devaluing of our lives, that our lives are not worth living. And I can share on a personal basis, my life is very much worth living. And I want people to recognize that and realize that time is running out, and lives are at stake. Now is the time.
Thank you, Dr. Ayers. So well put. Our final presenter is Sylvia Yi. Sylvia is a senior staff attorney at the Disability Rights Education and Defense Fund, or DREDF, as it's often called. She's also a member of the California Vaccine Community Advisory Committee, who can give us sort of an update on where things might stand here in the state. Thank you, Sylvia.
Thank you, Judy. I wanted to speak just a little bit. I know on last Monday, Governor Newsom had a press conference, and in response to a question, he indicated that he is thinking about the needs of people with developmental disabilities and how they would fit into the state's vaccine prioritization system. So I think the reference is hopeful, but it must be matched with an actual recognition of people with disabilities in the state's prioritization, a concrete timeline, and it must be inclusive enough to reach all the people with disabilities that are at higher risk of exposure to and death from COVID-19 because of their disabilities. That includes many of those with pre-existing conditions that have been recognized by the CDC, as Dr. Burgart indicated. That also includes, yes, people with developmental disabilities, but it also must include people who need to open their homes to frontline personal care assistance, to get out of bed and function in their communities, people like Josh. And it must include people who are on the cusp of getting new permanent impairments or additional health conditions, or just dying because they cannot safely leave their homes for the treatments they need for their disabilities, like Eduardo. The governor talked Monday about looking forward to moving from a scarcity mindset to an abundance mindset. We understand that the vaccines are scarce, but it says something very ugly about our values as a state if we tell people with disabilities that they have to wait at the back of the line until we have enough vaccine to remember them. I've heard other people say, well, we must be patient because eventually we will all get the vaccine. But as is very clear from those who shared today, Eduardo and Linda and Josh are not going to get the vaccine. Thank you.
Thank you so much, Sylvia. That was incredible. So we're going to now open it up for questions from the press who are on. Please, you can either put something in the chat, or you also can use the raise hand feature, and I'm happy to call on you. You can find raise hand feature by clicking on reactions and raising your hand like I just did. So are there any questions from reporters at this time, or anyone in our audience? And when you ask a question, please identify yourself. Any questions? You know what I'd like to do while people are thinking about questions is I just want to make sure that people know where everybody is from. Hector, can you just say where Eduardo lived, just for context?
Yeah, he lived here in LA County in a brand new apartment that he just got. He had about 1.5 years in Van Nuys, here in the San Fernando Valley. You know, he lived there a mile away from the hospital, but it was assigned, you know, so like he could have easy access, but he couldn't even like walk or take the bus there. Sometimes, you know, as speakers mentioned, when he would go to the hospital, he would leave because he was so terrified that he was there by himself. He didn't understand a lot of the stuff that was said. You know, he didn't have the phone. And even though he made a Americans with Disability Act recommendation to have, you know, a caretaker or somebody there with him, we fought tooth and nail, and that would never happen. I would be there at the hospitals. You know, it wasn't until the end. You know, so this was his community, and you know.
Thank you, Hector. Urix, where did you and Linda live?
We were lifelong Los Angeles County residents, and we bought our house. We moved to Fontana in San Bernardino County, and that's where we made our lives.
Thank you, Urix. And Julie, can you tell us where Joshua lived?
He was living in North Hills in the San Fernando Valley.
Okay, great, thank you. I'm seeing no questions from any of reporters. I know that I've gotten a couple of messages of reporters who want to do separate interviews, so we can certainly arrange for that. If any reporters have questions for follow-up, please feel free to contact us. I will go ahead and put my contact information in the chat so that you have it.
Hey, Judy, I hate to interrupt. This is Ed Herzl, Program Assistance for Disability Voices United. Colleen Shalby is raising her hand.
Oh, there she is. Thank you. Go ahead, Colleen. Go ahead and unmute yourself.
Hi, thanks for taking my question. You know, since we keep hearing that vaccine supply is limited, I guess I'm wondering from any of your standpoints, if you feel like expanding eligibility to those with disabilities and high-risk conditions right now will make a difference even if there's not enough supply. Like, would that type of message make a difference at this point, even if kind of the word doesn't match what is actually available?
Colleen, can I just ask your newspaper? Or...
Oh, sure. I'm a reporter with the LA Times.
Okay, thanks, Colleen. Do you want to take that, Sylvia, or did you want me to?
Sure. I do think it will make a difference because we also hear stories of people who are who are being turned away right at that gate. Right? They can't even make an appointment. They may manage to get through, which is hard enough. Or for some who are, let's say, going with their caretakers, their personal support people, and their personal support person is driving, that person is eligible to get their own vaccine, but they can't get the vaccine for their adult child with disabilities or someone else that they're caring for. And they're in the car together. The opportunity is there, but they can't feel that they can't vaccinate the younger person with a disability because they're not on the list. I do also think that the steps that the state is trying to take towards equity and making, as they work towards mobile vaccination clinics and hopefully house call vaccination, that will also make a significant difference to people with disabilities who cannot leave their homes.
And I can add, this is Kara Ayers, that, I mean, we've seen in other states that it has made a positive difference. So other states are also having their shortage issues, but by prioritizing disabilities among those at least eligible, then at least it gives people, a fighting chance to be, as examples that Sylvia provided. I mean, it's still unfair and the process is awful and we can't stop talking about that and working on that, but at least we're seeing some people, getting through and accessing the vaccine.
Thank you. Alyssa, and can I ask Ed, can you please spotlight the speaker as they're talking so everybody's just not seeing me? Thank you. Yep. Okay, go ahead, Alyssa.
Sure. So something additionally, I think it's very important to add is, we're seeing Pfizer trying to ramp up production of vaccine production. We're seeing Moderna do the same thing. We're eagerly waiting to see if the Johnson & Johnson vaccine will be released for emergency use. And so, as more vaccine becomes available, it's so important that we're ensuring that we're getting the highest risk people vaccinated as soon as possible. We all share the same goal that everyone in our state is able to get access to vaccination, but putting people with high risk conditions at the back of the line doesn't make sense.
And I just want to add, as Hector was saying at the beginning, that there were 7,000 vaccines left over yesterday at Dodger Stadium. And so I'm a parent of a 24-year-old young man with autism. And I'm on many, many different parent lists on Facebook, parent groups. And you could not even imagine how much discussion there was going on. Somebody had heard it on the radio. Everybody's literally, parents are throwing their children into the car, driving down to Dodger Stadium in the incredible hope that they can get a vaccine for their child who they feel is at very, very high risk of dying from COVID. So, for me, honestly, as a disability rights advocate, but also as a parent, having just saying that people with high risk disabilities are on the list is enough because we will get there. We will get to that point where there will be enough doses. I know that the governor promised that by the end of the week, which by the way is tomorrow, they would have a plan. And we know that 11:15, the Secretary of Health and Human Services, the governor is having a press conference actually in Fresno at 11:15, I believe. And the Secretary of Health and Human Services tomorrow is having a press conference. We are waiting for that specific plan. We believe we can make that plan happen. There are lots of resources in the disability community to make that plan work very seamlessly, even for those people who are, really more isolated and have more difficulty traveling to the massive sites. But there are a whole lot of people who can get to those mass vaccination sites. And let's get those available right now to protect these high-risk folks.
Judy, can I add something to what you just said?
Yeah, go ahead, Hector.
This whole thing about there's not enough, we all have to be patient. As a Native person, this is not our first pandemic, and the response is just familiar. As a disabled person, it's just the promises and the waiting, and then nothing happens, and then more of our people die. It's very familiar. Governor Brown and our new President Biden have both mentioned that there are people with disabilities. I mean, they certainly mentioned when they're running for campaigns, that's how we know they're part of the disability community. So to kind of, in a way, give the impression that they're contributing to the genocide of their own people, it's so disturbing. When the governor was having the talks about the vaccine and the groups that were working, like the one that Sylvia is part of, months ago, in the same room, I was listening to these talks with my brother, and he was very worried that at the end nothing was going to happen, because it's just something, it's like the intersectional kind of history that we have as gay people, as Native American people, people of color. We always hear, wait your turn. There's not enough, wait your turn, you know? And it's who is saying wait your turn that perhaps speaks to itself. When my second uncle died, I made the decision to sign up for the vaccine trial. And it was very scary because we were hearing about people that were having side effects. I did it in secret. My brother was the only one that knew. We didn't tell my family because they were so afraid, you know, but I did it to help fight the stigma, but I did it also because I wanted people to know that people with disabilities helped to create the vaccine, helped to go to the trials. And yet, as we die in masses, we are being told to wait. You know, that feels even more insulting. I signed up for the vaccine, not having a family, knowing that whatever happened, I could deal with it better as a disabled person. And perhaps I had less to lose than others. I lost a lot, you know, just by waiting. And so the argument that we have to wait as people with disabilities to wait our turn, despite the fact that we have already been working and talking, it's even more traumatic and more offensive. Accountability is part of equity, and I think this is what we're doing, and probably why a lot of people feel that we're attacking them. But I don't think they realize that the reason that they feel attacked is because they're not aware that their decisions are hurting us so much. So I don't know why we have to keep waiting. I don't know who made that decision. It certainly wasn't us. It certainly wasn't my brother or anybody else who has passed. So I don't think how you can keep telling us to wait our turn. Maybe to wait our turn to die. That's not what I think they're saying, but that's what it feels like.
Yeah, I agree, Hector. And there's just, I just feel like there's no more excuses. Like we keep hearing excuse after excuse from the governor and from his folks. We got to figure out a plan, and the plan's going to be really complicated. And yet they didn't need a plan to get it out to senior citizens and people who are older. Now they're realizing that there's a whole bunch of people who've been left out. And so they're making sure to use mobile units, but just no more excuses. Let's just put people with high-risk disabilities on the list, and we'll figure out how to get it to them. We've got the capacity to do that. Alyssa, you wanted to add something.
I just think that's such an incredibly important point regarding, this doesn't have to be complicated. And, now that, disability community advocates have a place at the table with, with the state, I really hope we can continue to push that it doesn't have to be complicated. Listen to the disability community, listen to those voices, because as you've mentioned and as others have mentioned, this is something we can do. And the state, in fact, can utilize some of its own resources that it has already developed. We already know where to find people through regional centers. We already know where to find all of the people who are receiving in-home health services. And, moving beyond that to anybody else who has a high-risk disability, we can absolutely utilize our partners in the healthcare community to help with that. So this doesn't have to be complicated. We can do this together. It's all about just setting the priority, getting the right people on the list, and that means getting high-risk Californians on the list as soon as possible.
Thank you so much, Alyssa. So I'm seeing no other questions at this time from reporters. I know that one of our community members asked how they can help. We are still encouraging people to call and write Governor Newsom. I know people who are doing it every single day. They're also writing their state legislators. They're also writing their local officials to say, prioritize us. I know many members of the California legislature are saying this is outrageous and are calling upon the governor to prioritize people with high-risk disabilities. We feel we have the support, and we're tired of the excuses. So hopefully we will hear some good news tomorrow with a specific date that is very, very soon for people with disabilities to be able to get access to the vaccine. Are there any closing words before we close the press conference from any of our presenters?
Well, I just have to say, the whole idea of senior citizens being prioritized, I'm a senior citizen, I'm 63. And one of the things I discussed with Linda is the fact that I would gladly give up my place in line. I mean, I'm 63, I have the comparative health. Last time it was checked of someone in their early 40s. So my chances of having an extremely negative reaction to COVID-19 is much less than someone who is not a senior citizen like Linda was. I think, again, other factors such as the disabilities should be weighed in. Just the arbitrary number of an age is just ridiculous to use to exclude so many people who are much more in need.
Well, that was really, really well said. Anyone else would like to give any closing comments? All right, seeing none, we want to thank everybody for joining us today. Please reach out if you have any. Oh, Hector, did you want to say something, or are you good?
I just wanted to thank you for doing this. My brother was an uncle. He had 2 nieces and 2 nephews. And even though I am really wonderful, he was their #1 favorite uncle. And it's amazing to see the wonderful impact that he's had on them. And I always told him, take care of yourself. You know, I told you so. I told you, take care of yourself. You know, and I think now as he's moved on, I have to remind him that I told him so, that he has a lot of people that loved him and a lot of people that care for him. Now I have to work hard at being a brother to my sisters and an uncle to my nieces, and I have to work extra hard to being a son to my mother. And I just want to remind that these are people, real wonderful human beings, high-risk Californians, that we contribute. We are part of our community. We are what make California what it is. If we die, if you let us die, if you let us suffer like that, that's what California becomes. I want to thank you for that.
Thank you so much, Hector. And we want to thank all the reporters who joined us today. And please reach out if you have any additional questions. Thank you, everybody. And please stay safe out there. Take care.
Thank you, Judy.